Our program, like I said, is back up and running. We've done more than 1,700 county-issued COVID tests since Thursday. We have 2 clinics using CDC trailers. Friday will be at the Wheaton Rec Department. Both these testing sites are drive-ups. On the average, the time for us to get specimen results back has been 62 hours. We're hoping that we can get this back and continue to push this below 62 hours. It would be good to be basically on 24 hours so we can very rapidly get ourselves on the trail of the contacts that people have had. You got to remember, every day we don't know whether somebody's positive is a day that we don't know whether that person's spreading. And so the sooner we get control over this, the better off we'll be. Our testing volume in the state is down. Totals are below 15,000. We had much higher testing volumes. So if you're seeing lower cases at the state level, they're also testing fewer people at the state level. This is one of the other scenarios which worries people. I can make cases go away if I don't test people. That doesn't mean they're not there. It just means that we don't see them. So we're trying to ramp our testing back up. And hopefully what's happening at the statewide level is a glitch and something that eventually will get to higher levels of testing.
We've had a number of days where we've seen decreased test volume in terms of the tests being resulted, and we're starting to see that become more common. We're continuing to monitor that trend, and we're continuing to try to understand what's driving that, and that's not only necessarily here locally, but across the state, to get a better understanding if it's a question of access to testing fatigue, or people just simply aren't showing up to get tested based upon any of the recent conversations about guidelines. And so it's important to understand when we look at the total number of results resulted, we also look at a host of those other measures, test positivity and the number of tests that it is out of.